Panel 2, the good, the bad, and the ugly, empowering patients to implement research evidence. So it's a good follow-through on the conversation that we just had. And Vivian, you're first up, and your title is Variation in How Clinical Practice Guidelines Include the Consumer Perspective. And this is Vivian Coates from the National Guidelines Clearinghouse, Project Director at the ECRI Institute.
Okay, so full disclosure, thank you. And it's an honor for me to be here. I just have admired this organization for, ever since I first heard about it. I think, Kay, your work, Tabby, your work is just extraordinary. And you were a trendsetter years before this became what everybody aspires to. So thank you. The other thing I have to say is that I'm not wearing my hat as project director at ECRI for the National Guideline Clearinghouse. I'm here to talk about some work that we did at my organization outside of what we do in the National Guideline Clearinghouse to look at variation in how guidelines include the consumer perspective. So that's full disclosure. So I'm going to just say a little word about my organization and talk a little bit about how we figured out the extent of patient or consumer involvement in guidelines, what the evidence showed when we did that, a little bit about the Institute of Medicine, now known as the National Academy of Medicine, standards, and then I will draw on some examples from the National Guideline Clearinghouse that shows the variability in how this is addressed. And I'd like to acknowledge the work of Lisa Haskell on my staff in this, and also Dr. Amy Zoe. So what is ECRI Institute? Well, we're a nonprofit health services research organization. We've been around quite a while, and we've worked for many years on methodology and implementation issues around clinical practice guidelines. And our clients are worldwide, and they include these kinds of organizations. We do a lot of work for the government, and in particular for ARC. We've been one of the original evidence-based practice centers since the beginning of the program, and are the contractor to do not only the National Guideline Clearinghouse, but the sister National Quality Measures Clearinghouse. So how can we determine patient involvement in existing guidelines? Well, we used the Agree-To instrument, which is right now the most widely used tool to assess quality and reporting in practice guidelines or of practice guidelines. And so Agree is enabling the people who use it to score guidelines on how well they fulfill a number of criteria. And with regard to what they call stakeholder involvement, they're looking at whether the guideline development group included individuals from all relevant professional groups, but also whether they sought the views and preferences of the target population, and whether the target users of the guideline are clearly defined. And so this is domain 2, item 5 within the tool. And so it's asking, does the guideline explicitly state how it captured consumer views and preferences, and during what stage of the guideline development? And it's not just enough to capture that. Does the guideline explicitly state how these views and preferences were used in the formulation of recommendations? And so this is also making me think of something that comes up again and again in guideline development. It's not only about what was done, it's also about how well the guideline developer documented what was actually done in the guideline, the document that calls itself the guideline, and or additional technical reports and And so often in speaking with many guideline developers over many years, they say to me, oh, yeah, we did that. But it didn't mean they actually wrote it down, much less included how they did that in the guideline itself. So in this particular project, we appraised more than 750 guidelines from guideline developers from 6 geographic regions. And we chose those guidelines because they were the most frequently downloaded by primary care providers using a commercial clinical decision support resource. And these were guidelines that were published in the period 2005 to 2016. And when we looked at these different domains, the stakeholder involvement domain was one of 4 showing high variability, meaning they didn't all do it the same way. So with regard to the particular item around stakeholder involvement, how well did they do? Not really very well. So nearly 400 of this cohort of guidelines only scored a 1 out of 7 with regard to stakeholder involvement. Some of the guidelines scored 7 out of 7, and so harking back to the last presentation, the UK did the best. So they actually had 38 guidelines that scored 7 out of 7. Scotland, which last time I looked actually is in the UK, had 10. US had 9, Canada had 2, the World Health Organization 2, and Australia 1. So what about guideline experience? Do guideline developers who develop more guidelines do better with stakeholder involvement? So we found that to be the case. In fact, organizations that developed 10 or more guidelines were significantly better in their rating. They were rated a median of 4 at seeking input from the target populations compared to organizations developing fewer than 10, only getting a median rating of 1. This slide is just showing that of the nearly 100 guidelines that received the highest rating for incorporating input from the target population, 2/3 of those guidelines were produced by guideline developers who had the greater experience. And so I'm going to single out, more than once, I'm going to single out in the UK NICE, the National Institute for Clinical Excellence, and of that grouping of guidelines published from 2005 to 2016, more than 60% of the ones produced by NICE incorporated that kind of input. So over time, did we see an improvement? A small but statistically significant improvement in stakeholder involvement, looking at guidelines published before and then after 2011. I wished I could say that, from 2012 to 2016, which are the guidelines that were published after the Institute of Medicine standards calling for this were issued. I wish I could say there was a huge sea change and all of a sudden, the guidelines were scoring better, but we didn't see that. So in terms of the guideline topics, were some more likely to include the patient or consumer perspective, and the prize absolutely goes to guidelines in the HIV/AIDS area. Maybe because it's a relatively new disease, and early researchers quickly learned that the patients themselves were the best, they're certainly a very good source for information on the disease. And I think that over time, since patients were included from the very beginning, it became an expectation that they needed to be there. So we certainly saw HIV/AIDS guidelines, much more imbued with the need for consumer involvement. So the Institute of Medicine standards, so these were standards that were, as I said, issued in 2011, and the report, which was a landmark report, is Clinical Practice Guidelines We Can Trust, that included the famous standards for trustworthy guidelines. And there were explicit with regard to who should be in the guideline development group. It should be it should include populations expected to be affected by the guideline recommendations, and that patient and public involvement should be facilitated at least at the time of formulating the questions that the guideline is going to address, and again, when the draft guideline goes up for review. And it should include at least a current or former patient and a patient advocate or patient consumer organization in the guideline development group. And it went on to say that proactively, the guideline development group should adopt strategies to increase effective participation of consumers, including training in appraisal of evidence. So I think that, is an acknowledgement of the role of an organization like HUE. So what does this kind of patient involvement, consumer involvement look like? Well, really a variety of methods that we could see. So it ranged from embedding consumers in the guideline development team, working with advocacy groups, using public comment to gather input, and either consulting or conducting research on consumer perspectives. And so now I am going to look at some examples from the National Guideline Clearinghouse. Before I do that, I just want to put a plug in for the fact that we just launched all new websites for ARC, for the National Guideline Clearinghouse. It's optimized now for the mobile environment, so you can search it beautifully from your phone or from your tablet as well as from your computer. Has anyone looked at that new website? So I'm encouraging, it's at www.guideline.gov. Okay, yeah. Okay, so again, NICE, they provide the best example. I won't read this to you, but they have an extensive program for facilitating and encouraging consumer involvement. This is a Canadian example from an independent expert panel where, again, they embedded consumers in the guideline development team. Two other examples, the American Psychiatric Association and the Renal Physician Association, where they were having recommendations. This is more at the front end, at the beginning of the process, with regard to the first example, the next example at the end of the process. Here are two examples where public comment was used, where consumer involvement was sought at the draft stage. And here's a last example from the World Health Organization, where they actually conducted qualitative research into values and preferences to inform the systematic review that underpinned the guideline. So in conclusion, I think it's across the board that guideline developers are aware that patient and consumer perspectives should be included in the guideline development, but they're hugely uncertain about how to best do this, and we're just seeing incremental improvement, one developer at a time. Thank you.